So quite often I have people contact me asking, how do I even know I'm a good candidate for a low carbohydrate or ketogenic approach? And I'm going to do a separate video with an overview of the main metabolic conditions and where we stand with research. And that's, of course, a really good guidance as well. Who is this good for? Who is eligible? Who can benefit? But let's also go into the symptoms. How do you feel you have a metabolic problem? And how can you then decide that's definitely the route you want to embark on? So there are a few crucial questions. One of the first ones that I always ask is, how do you feel after a meal? Or also before a meal, of course. But importantly, it is good to notice, okay, do I gain energy from a meal, significant energy, which could point to a metabolic issue? And conversely also, am I absolutely knackered after a meal? Do I almost go into a food coma, or do I have that very typical 3 o'clock slump, or, even earlier than 3 o'clock after a lunch? So this is really an important question to ask yourself. And that goes into, having big energy dips during the day. And quite typically that happens sort of mid-afternoon. And I've witnessed that quite a bit when I was working in a big office. And then also cravings. Do you quite often have to resort to chocolate or caffeine or any other stimulants to keep yourself going? Or worse even, are you waking up at night, in the middle of the night, and you feel like raiding the fridge and you've got to eat, otherwise you just cannot go back to sleep? And then certainly also emotions. Do you get super emotional, or we sometimes call it hangry as well? So a combination of hunger and anger. Does that happen to you quite often, that your brain just simply cannot function unless you get something to eat? Also, waking up in the morning absolutely knackered, although you've had a fairly decent night's sleep, can also a sign and symptom of metabolic dysregulation, and you could benefit from doing work in that area. But there are also physical symptoms, quite typical for instance, insulin resistance or related conditions are those skin tags, or just also small lipomas. I had quite a large lipoma actually on my thigh. And also excess hair growth, be that in, women especially, they notice it more, but it can also sometimes happen in men. And then also those skin discoloration, typically happening in folds. So your neck fold, or also under the arms. That's also something that I notice can indicate metabolic issues. So just very briefly, I've got very vast clinical experience using different types and different degrees of carbohydrate restriction over the past 11 years. So first of all, of course, fat loss, especially without deprivation, can be an important one, and quite a common one as well. Inflammatory conditions and pain, I have noticed that people do report that not only have they addressed the primary condition they actually came to me for, but that their pain and, for instance, arthritis or joint pains has reduced. Then also in pernicious anemia, I have quite a lot of experience with that. Of course, also people who have been through treatment, who have had this as a side effect, and how we improve gut function in particular as well, with or in tandem with blood glucose dysregulation, can be very successful. Addressing blood pressure or other cardiovascularly related conditions. Of course, type 2 diabetes is also quite an obvious one, but actually also in type 1 diabetes, carbohydrate restriction can be very successful. And it is a supportive tool for cancer patients. We find more and more out about that, how we can best support the success of their conventional treatments. And then, of course, also hormonal issues. So menopausal issues, PCOS, polycystic ovary syndrome, skin related issues like acne, which are also hormone driven, infertility. So there's quite a lot of stories that I have collected over the years. And while I think metabolic therapies are incredibly promising for many different conditions, there are very clear contraindications. And these are the absolute contraindications. If you have been diagnosed with one of them, usually as a newborn or as a baby, so people do know about this, it's not something that just happens all of a sudden in our life, then please do not embark on a ketogenic diet. And even with carbohydrate restriction, be cautious. So the first one is carnitine deficiency, because carnitine is absolutely essential for shuttling fatty acids into the energy cycle. And also somewhat related is carnityl palmitoyl transferase 1 or 2 deficiency. And then there's something called pyruvate carboxylase deficiency, and of course also defects in pathways of beta oxidation or fatty acid oxidation. Porphyria, I have a question mark here. This can actually be a condition that develops in adulthood, but I also know people who have successfully implemented a ketogenic diet with porphyria. And although it is often in the scientific literature mentioned as an absolute contraindication, I am not quite sure about that one. And then we also have the relative contraindications. And that means that it's not an absolute no-no, but you definitely need very clear personalization, very diligent monitoring, especially as well, to make this work for you. So the first one is abnormalities in blood biochemistry. And I'm not talking about, we just have the white blood count a little bit below the range. It's really very severe deficiency or excesses as well. A history of pancreatitis also always cautions me to be extra diligent. Active gallbladder disease, or of course also the lack of a gallbladder. If you've had your gallbladder removed, we need to take certain precautions and we need to take it easy transitioning. It doesn't mean you can't do it. It just means you need potentially or most likely extra supplements and extra support. Same with certain heart conditions, rhythm disorders, for instance, a history of kidney failure. There is great promise in treating PKD, for instance, or other kidney conditions with a ketogenic diet, but it needs to be super tailored. Generally, poor nutritional status. I'm also very cautious, or malabsorption, for instance. Also a gastric bypass. And when talking about malabsorption, that obviously flows into this when we have abdominal tumors or impaired gut function, or also liver tumors, because the liver is responsible for converting free fatty acids into ketones, and we need to give the liver extra support when this is the case. Medication needs adaptation. There's absolutely no doubt. Whether you are doing carbohydrate restriction for a mental health disorder, for blood pressure, for type 2 diabetes, it always needs looking at. And that's really, really important. So if you are on drugs, on medication, please make sure you take that into account. So what does it take? And, who is a good candidate and who needs to be on board, and how do we need to be on board? So there's absolutely no doubt that making radical dietary changes, and I'm not just talking about embarking on metabolic therapies, that also is the case when you're going on a vegan diet, or when you're going on just something that is a little bit out of the ordinary. It needs commitment. And you need to be with your mind, we need to be fully on board. And also curiosity. And I don't just mean curiosity in terms of, what is possible, but also curiosity to really get to know your body, and to also be ready to not just learn new skills and acquire new knowledge, but quite often also to unlearn. So to be open-minded and to go with data instead of dogma. So something you thought was true in the food and nutrition world, all your life might actually just crumble, especially when we start to personalize. And personalization is, in my view, an absolute essential, especially if we are using carbohydrate restriction for therapeutic purposes. It is key. And always remember that it is not a must to do these metabolic therapies, and that you are in control of your decisions. So it's a choice. It's not, nobody coerces you. And especially that applies to carers. If you are caring for a patient and you absolutely would love them to embark on metabolic therapies, please be aware that education is so much more important than just coercion. I see it quite often that carers are so keen for a patient, a loved one, to do this, and the loved one is just simply not on board or is completely overwhelmed. So please be aware of this. And this is sort of a first brief overview of who this is for, and especially who will also benefit from my services, from my support, my courses and programs. And I'll be in touch very soon with another video. Thanks for watching. Bye.